Hi, my name's Kaan,
And my name's Asia, and we are students at Lake Washington High School in Kirkland, Washington.
and today we're going to talk about what it's like to be an OMS, also known as an oral and maxillofacial surgeon.
How we decided on this career for a poster is actually quite simple.
I want to be a surgeon.
And I want to be a dentist.
Luckily, over winter break, I had the chance to shadow my local dentist, and I saw them do a few minor procedures such as sealants and fillings. This only took my interest in dentistry even further.
Since we partnered up, combining our two interests into the career of a dental surgeon was highly efficient. This way, our poster is centered around a career we are both very passionate about.
Maybe you're wondering, what would an OMS even do? I mean, I've never even heard of one before.
In fact, there are only 50 OMS in Washington State.
But don't let that fact diminish the importance this career holds.
That's right. Oral maxillofacial surgeons are responsible for treating,
Reconstructing, and diagnosing any injuries or birth anomalies regarding the overall skull and head area.
and in some cases, even the neck.
And trust me, this job isn't easy. To be proficient in this career, one must have good coordination,
As well as good judgment, time management, critical thinking, and the ability to work well under high pressure. But before we get into the specifics, let's talk about educational requirements.
Becoming an OMS is difficult, with a total of 8 years of education and 4 years of training, all after graduating high school.
Firstly, a student must take 4 years of college, earning an undergraduate degree.
And of course, there are multiple prerequisites such as chemistry, organic chemistry, biology, and even physics.
Exactly. Then the student is enrolled in dental school for another 4 years, the first two being preclinical and the second two being clinical.
Once they graduate with a degree in DDS, also known as Doctor of Dental Surgery, or DMD, Doctor of Medicine and Dentistry, they will begin their hospital-based residency training.
Which is yet again for another 4 years. At the end of the training, they will receive a certification from the American Board of Oral and Maxillofacial Surgery.
This will allow them to obtain a state licensure to begin practicing oral and maxillofacial surgery.
Some job responsibilities include determining if wisdom teeth surgery is needed,
Conducting surgery for dental implants with the purpose of aiding the regeneration of deficient bone and gum tissues,
removing defective teeth and treating infections in oral areas,
removing tumors within oral and facial regions.
and many others, such as treating the conditions like a cleft lip.
Common procedures relating to these responsibilities are reconstructive surgery, orthognathic surgery, TMJ treatment, also known as temporomandibular joint treatment, and tooth extractions.
Reconstructive surgery is most commonly performed on the mandible, also known as the lower jaw, but can also be done on the zygomatic complex or the maxilla.
It is usually done to treat trauma such as facial fractures or problems like cancer or tumors.
Orthognathic surgery is usually done to realign any misaligned jaws.
This also takes place on the maxilla and mandible, with a common surgery being Lafort osteotomies, which takes place on the maxilla.
TMJ treatment is done on a joint rather than a bone.
TMJ treatment is usually done to help patients relieve pain, restore jaw functions, or stabilize the joint in general.
Tooth extraction is done to remove any decayed, fractured, or unsalvageable teeth that have gone way beyond repair and restoration,
OMS can also be responsible for minor cosmetic procedures.
such as cheekbone enhancements, which are done by placing biocompatible implants such as silicone in tiny, unnoticeable incisions.
Now, let's begin talking about entry-level salaries.
With all the time in school and responsibilities that comes with the job, OMS are compensated very well.
Exactly. Although they don't make as much as your typical surgeon, they still make upwards of $225,000 per year.
And nationally in the United States, $300,000 to $334,000 is the yearly average wage, with an average monthly wage of $25,000.
And making up to even $160 per hour,
Along with these high wages, OMS receives other benefits,
such as malpractice, health, dental, vision, and life insurance coverage.
not to mention the added bonuses, pension plans in some hospitals, and paid holidays.
And there are many more benefits.
On top of the high potential wages, one also gains more knowledge in the field of science.
OMS also have much more flexible work hours in comparison to other surgery or medicine careers.
And they have the ability to quite literally put a smile back on someone's face.
That's right. When proficient in practicing OMS, it is very rewarding and respectable.
This doesn't mean there aren't any challenges that come along with a career.
Apart from the extensive years of education, there are also potential student loans to pay off.
It also is common to have very high stress levels due to the immense responsibilities involved in the career.
Physical strain is also possible due to long hours of surgery.
Additionally, one can be affected mentally and emotionally when dealing with complex cases.
But overall, becoming an OMS is very rewarding.
Typical work settings are in private offices or hospitals.
And typical shifts are usually from 7 a.m. to 4 p.m. office hours with estimated 40-hour weeks.
but hospital calls tend to extend way past office hours.
Getting used to the high stress and fast paced work environment involved with this career definitely isn't easy, but it's most definitely worth it.
This was a great opportunity to learn more about a career we're both very interested in.
And I hope you all enjoyed our presentation and found it very informative.
Thank
Thank
you.
you.